Good afternoon. Today is July the 19th, 2023, and today is Glioblastoma Multiforme Awareness Day. If you're new to my page, I am Dr. Wolf. I am a pathologist, and glioblastoma multiforme is a malignant brain tumor. In this video, I'm going to talk just a little bit about glioblastoma. I'm going to show you a picture of an actual glioblastoma, so if you're squeamish, you might scroll away. But I'm also going to show you a little model of what brain tumors are like and why these are difficult to deal with. Now, among brain tumors, meningioma is the most common, but among malignant brain tumors, because meningiomas don't tend to be malignant, glioblastoma is the most common. Survival for this tumor is unfortunately poor, tends to be about 10 to 12 months on average. The 5-year survival is somewhere between 5 and 10%. This is a tumor that is treated with multiple modalities, meaning it can be surgery, chemotherapy, radiation, but the problem is that even when you take it all out, they tend to recur. And also the cells can be resistant to chemotherapy and radiation. One of the big problems is that it's difficult to get drugs across what's called the blood-brain barrier that are effective against this tumor. So I'm going to do a little demonstration to show you what a brain tumor is like conceptually versus reality. What you're seeing here is a very crudely made brain that I made from kinetic sand, and that inside of this is a tumor. So I'm going to cut this and I'm going to show you what conceptually we see. Okay, conceptually, meaning not reality, is that we see a very sharp margin, if you can imagine that this is the glioblastoma and this is the surrounding brain tissue. And so you might think, well, you can just, pluck this out and it's fine. But that is not reality. Reality, however, is a little bit more like this example. I'm going to cut into this mock brain here, and I'm going to open it and show you that. Notice how that looks a little more hazy. And there you can see little bits of purple which represent tumor. The idea is that it's difficult for a surgeon to look at this and know exactly where the margin is. Okay, so why not just take out a huge margin? Well, the problem is when you take out a large amount of brain tissue, you're also taking out tissue that you need for functioning. Okay, behind me is an actual slice of brain with a brain tumor. I took this picture from a textbook. This is not my case. So if you're squeamish, you can scroll away. Now, this area above my head is the glioblastoma tumor, that dark tan, light brown area. And then this white diamond there just showing that there's midline shift. So please consider donating to research for this deadly disease.